Welcome to Medical Dose. Today we will talk about a health problem many people feel shy to speak about. It causes pain, discomfort, and sometimes embarrassment, but it is more common than people think. It is called anal fistula. Some people think it is just a small wound. Others ignore it for months or even years. The truth is, anal fistula does not heal by itself. But the good news, it can be treated. Today, we will explain it in a very simple way. No fear, no complicated medical words, just clear answers. Today we are joined by Dr. Maher Abbas, a consultant colorectal surgeon at AlZahra Hospital Dubai. Thank you very much for being here, doctor.
Thank you for inviting me.
So let's start. What is the fistula exactly?
So anal fistula is a medical condition that basically involves the creation of a tunnel, a communication between two organs. The most common site for fistulas usually are the digestive tract, the intestine, and the one we most commonly see is in the anal area.
So, doctor, where do you see it common? And which ages? Who's is it more in male, females? Where do you see it more?
Yes. We see it in both genders, and we see it in all
equally?
age.
Or
equally in some cases,
yeah.
although
Okay.
we tend to see more males, especially in the GCC. It can occur at any age from infancy to old age, but most commonly it presents people between the age of 20 and the age of 50.
Why does it start? Why it happened?
Despite a lot of scientific advances, we still don't have a very good explanation of why some patients develop anal fistula. The theory that is most commonly cited is that we have anal glands. Anal glands are similar to saliva gland. Their function is to try to lubricate the passage of stool. And if one of these glands gets plugged by bacteria and stool, it leads to an infection and the formation of anal fistula. Also, other conditions that can lead to anal fistula that are less common, such as inflammatory bowel disease, specifically Crohn's disease, or atypical infection like tuberculosis or other type of infection as well. In rare cases, can also be related to radiation or a cancer.
Oh, okay. So infection is the main, and then other
conditions are less common, correct.
So what are the first signs that anyone needs to see or observe so they can check?
Yes. So some patient will present, the first manifestation of anal fistula is an abscess in the anal area where they present with swelling, severe pain, fever, and redness on the skin, and they feel a bump. Usually that's one of the manifestations of anal fistula initially, but in some patient it can present just a sudden spontaneous opening in the skin and patients start draining liquid from the skin area.
Why most of people shy to talk about it?
Yeah, the anal area obviously is a sensitive topic. Often patients feel ashamed when something develops in the area. Often early on, they don't know what's happening. Many patients think initially that this is piles or hemorrhoid. They don't think of anal infection because often patients talk about hemorrhoids, but they don't tend to talk much about anal fistula and anal abscess.
So, doctor, the patients needs to come after pain. Usually it has to be pain and then diagnosis.
Yeah, so often if suddenly a patient starts experiencing pain that doesn't go away within a day or two, especially if it's accompanied by significant swelling, drainage, or fever, they should come for evaluation.
So it's always can be diagnosed by scan, or it needs only the clinical check that can see what's happening there?
Yes. The majority of patients we can diagnose at the bedside, meaning just by the history of the patient that they share with us, especially if there's drainage or fever or swelling in the area, but also by bedside physical examination usually is sufficient. In some patients, it can be tricky because the early manifestation of an internal fistula, on the outside, there may not be much to be seen, yet the patient has symptoms, in which case we tend to rely a lot on imaging, on radiologic studies to make the diagnosis.
But you were talking about the infections and cancer and some condition. Is the poor hygiene in the area could cause?
There has never been a study that have documented that poor hygiene can lead to additional anal fistula. There have been theories about smoking, for instance, being associated. There have been several studies looking at smoking as a risk factor for development of anal fistula. There have been some studies that have proven that, and some studies that have shown no association. We also know there's a hormonal influence. That's why we tend to see it in people who are in their 20s to 50s years of age, where they hormonally were very active.
So, doctor, what are some mistakes that you see patients does before they come to you?
Yeah, often what we commonly see is patient ignoring the symptom for a while until they've had enough. Like they've been in a lot of discomfort and pain. They delay. Sometimes they're afraid to see a doctor. Sometimes they're ashamed to see a doctor. So kind of like delaying the diagnosis is the most common scenario that we do see. And we also sometimes, even after we make the diagnosis, some patients decline to have treatment. They'd rather try to live with the condition. I've operated on patients who present with 2 weeks of symptom. I've also operated on patients who suffered for 17 years before finally they decided to have surgery to treat the condition.
So what if ignored? What are the side effects for this? What will happen?
Yeah, this is a very common question that patients ask. What if I don't do anything? In the majority of patients, the symptom will remain the same, meaning they will get period of swelling, fever, drainage, pain, discomfort. And most patients with anal fistula, the symptoms are cyclical. Cyclical, what I mean by that is they're up and down. They are good days, good weeks, bad weeks. Sometimes the patient may not be aware that they have the condition. Sometimes they have more activity from it. So that's usually the most common scenario. In a small group of patients, if the skin closes and the fistula stop draining, they can form what we say an acute abscess, meaning suddenly they have a cavity that is full of pus that require emergency surgery to evacuate. Also, if you leave a fistula untreated, and some patients can start branching out, creating new fistulas in other parts of the anal area and can become more complicated as time goes by. And finally, very, very rarely, if patient goes untreated for 10 years or more, they can form a cancer in the fistula.
So, doctor, let's talk about the treatments. Besides surgery, all cases need surgery?
Yeah, in general, fistulas will not heal on their own. Typically, first we have to kind of diagnose the fistula. We have to work it up to make sure there's no inflammatory bowel disease, because patients who have inflammatory bowel disease like Crohn's disease would require both medical therapy, medication, plus surgery. If it's not related to inflammatory bowel disease, then the mainstream treatment is surgical. Now, patients often ask, can they take medication? Medication can temporize and alleviate the symptoms. So patient often ask, can I take antibiotic? And often if they do take antibiotic, they will feel better temporarily. But the minute they stop the antibiotic, the symptom will continue. And a word of caution, if patient uses too many antibiotic, they can become resistant. And so when they really need to have antibiotic for an operation or something, the choices become very limited in terms of what we can provide.
So mostly surgery is the best answer.
Yes, surgery. And this is not only surgery, but the surgery has to be done by someone who understands the disease. Often we see patients who've suffered from multiple operations being done by surgeons who really don't deal with the area much, trying to help the patient, but without clear understanding of how this disease behaves and what are the various options for the patient.
So it can come after the surgery if the surgery is not done in the right way.
Correct. Often we see failures, what we say failures of surgery, meaning the patient underwent an intervention, that intervention was not successful and the problem continues. Now, it's important to know that the more complex a fistula, the deeper it is, the more challenging it becomes to treat. And certainly, even in the hands of the best surgeons, the most expert, there is a small failure rate. But in general, most patients can be cured of the fistula. The question becomes whether one operation is necessary or more than one operation necessary to carry the patient through from the condition of a fistula to full healing.
Is it painful?
Yeah, in general, the anal area is sensitive. And often what I tell patients, for 1 to 2 weeks after the surgery, there will be some associated discomfort for which they need to take pain medication to help. They also need to keep the stool soft. They need to do like sitz bath to keep the area clean, etc. But in general, I advise most patients 1 to 2 weeks of surgery. And then depending on the type of operation that we do for fistula, the recovery, meaning full healing, can take up to 2 to 3 months sometime for the patient completely to heal the area.
Completely, 2 to 3 months. So what's your advice for people after the surgery for a good healing or good recovery time? Also not to go back to suffer from the case.
Yes. So the first thing in terms of what are the lifestyle recommendation we make, if a patient smoke, we usually try to advise them to stop smoking. All the studies that have been done on anal fistula and other proctologic surgery, in the setting of smoking, patients have a higher failure rate and more infections and slower healing. So usually if a patient is a smoker, I try to advise them before even doing the operation to quit smoking or decrease the amount of smoking. That's one thing that is very important. The second thing is we try to avoid any activities that cause a lot of stretching the buttock. We deal with a lot of patients nowadays who are a lot into fitness. They go to the gym, etc. So I tell them to kind of avoid activities that would involve like squatting, where there's a lot of stretching in the area. Also, in terms of dietary changes, it's very important for the patient to try to avoid spicy food, because spicy food can sometimes aggravate the wound. And also to avoid foods that constipate. Food typically that constipate, the most common one are red meat, to try to either avoid it completely during the recovery period or decrease the amount that they take. White bread and white pasta, these usually are the three culprits causing more constipation issue, which can lead to more pain when the patient goes to the bathroom. And also to avoid a lot of the citrus-based fruit like lemons, etc., and then spices, very important.
And what about water?
Water intake, we encourage patients to take water intake, and we also encourage patients to do sitz bath, where they get into a bathtub, they put liquid soap and water. And often patients ask, do they need to use things like betadine or other disinfection? Usually it's not necessary. If they wish to use it, they can, although prolonged use of betadine can sometimes impair and slow down the wound healing. So usually what I advise patients is liquid soap and water is usually sufficient to keep the area clean. And after they do the sitz bath in warm water, is to put a piece of gauze against the wound to absorb the moisture. So that would be very, very important. Patients also ask if they can swim or go to the ocean, and I specifically encourage them to go to the ocean because salt water have a lot of beneficial quality to healing.
So, doctor, one final advice for your patients.
Yes, I think when it comes to anal symptom, get checked. If patients have symptoms now, there are common disorders like hemorrhoid, which often can be self-limited. You go to the local pharmacy, use a little cream, you improve. But if you have symptoms that are either severe or don't clear with simple remedy that you get from the pharmacy, go get checked. And if you do go get checked and you are diagnosed with anal fistula and you require treatment, make sure you choose your doctor, your surgeon wisely, because this is an area that requires a lot of expertise, require people who not only understand the disease, but are also very good at the various type of operation that can be provided to help heal the patient. And it's also very, very important to try, when you're looking at clinics or looking at surgeons, is to try to go beyond the superficial marketing, because a lot of people market a lot of things, but really don't know how to deal with this condition. So you need to get someone who's done a lot of it in order to carry you through the process safely with a good outcome.
Thank you very much, Dr. Maher Abbas. We were enjoyed with all these information. Thank you very much.
Thank you.